Hello YouTube, this is Dr. Havercorn with River City Oral and Maxillofacial Surgery in San Antonio, Texas. It is probably about 10:20 at night on Monday, January 28th, 2019. And I just finished up a couple of surgeries in the operating room here at the hospital for infections. And I just shot a little video about infections. Now I want to do another video that's not really related to what I did tonight, but I want to talk about high blood pressure in the dental patient, okay? When I was teaching, and even now when I still teach, part-time at the dental school, I get lots of questions about this. In dental school and with the dental students, they're routinely taught that you shouldn't treat somebody with high blood pressure. Every doctor they talk to at the school gives them a different idea about what that means and how high is high and all that kind of stuff. Well, I just want to talk to you about how I approach that, okay? Because I also know that lots of primary care doctors and cardiologists are going to, if they see this video, they are going to want to give me a high five because they get these referrals or these consults or whatever, clearance letters from a dentist saying, hey, your patient has high blood pressure. Can you fix it before I treat them? Or is it okay if I treat them? Look, the limit for high blood pressure is dependent on what the situation is, okay? So if the patient, if you're a patient and you're going to go in and have like cosmetic dentistry done, you're going to have some veneers put on or just cosmetic surgery and a facelift, look, we might want to see your blood pressure in a better place because we might say, look, this is not an emergency. You don't need this care right now. So why don't you get your blood pressure under a little bit better control? That being said, though, look, some people just have, like we talk about, the white coat syndrome, or just that going to the dentist office drives their pressure up. So, the dentist has to learn, what's a tolerable blood pressure, because it may not be a perfect blood pressure. And then the other issue is, okay, maybe instead of cosmetic stuff, you actually have like somewhat of an urgent need. So maybe you got a cavity or a mild toothache that needs to be treated. Well, in a case like that, we might fudge the blood pressure a little bit and say, okay, it can be a little higher and we can still treat you because you've got something that needs to be done. And then there are the patients who have a bad problem. So like the patients I see, like the surgeries I did tonight in the hospital, people who need surgery within the next hours to day, or they're going to get into serious life-threatening trouble. Those kind of people, we almost don't care what their blood pressure is because they just have to have surgery, and we handle their blood pressure during the surgery and after the surgery as we need to. But the reason I'm filming this video is that I recently saw a dental patient referred to me about an extraction, and I just kind of looked at her chart and I said, oh, hey, your blood pressure's kind of high. It's like 180 over 125 or something. And the patient says, yeah, I've got a headache right now, and I had a headache last week, and I went to the ER for my headache, and it turned out it was my blood pressure. And, a couple days ago, I was walking from my car into the gas station, and I had to take a break because I was so short of breath. And I said, well, has that ever happened to you before? You don't look like, you're out of shape or anything. And the patient says, no, it's never happened before. Sorry, let me turn the light on. The patient says, hey, that's never happened to me before. Okay, so here we obviously have somebody with a high blood pressure with some early symptoms like a headache, and then also some shortness of breath, dyspnea on exertion, that's worrisome, for maybe a cardiac issue. That's somebody that we shouldn't be treating in the dental office unless there's a urgent reason. Like an actual infection. I would even say that possibly a toothache isn't a good reason to treat that person, at least not in the office setting. It just kind of depends on what's going on with their heart. But the interesting thing was I discussed this all with the dentist, and the dentist was unaware of any of it. The dentist had noted that the blood pressure was high, but felt like, like I said earlier, sometimes you don't really have to worry about the blood pressure. You just have to, sometimes it's okay, but didn't realize that the patient was having these other symptoms. So, what am I saying with this video? I guess I'm saying that I see a lot of mistakes both ways. I see, patients being told that, especially from like at the dental school where we've got students, they're still learning, and there's an abundance of caution, as they say. I see patients being told that basically if your blood pressure is not 120 over 70, we can't treat you. But then I also see people with like serious blood pressure issues that are just ignored. And I'll admit, when I started in my residency and I just finished dental school, I didn't know anything about this stuff. I had to read about it. And then, of course, in medical school, I learned about it. Um, but there's something called, there's just high blood pressure. And then there's a hypertensive urgency, which means not only is your blood pressure high, but we've got reason to believe that it's getting a little serious and we need to get it down within, say, 24 hours. And then we've got the hypertensive urgency, which is like, it's more than a little serious. You're starting to have what we talk about as end organ damage, or maybe some symptoms leading up to end organ damage. So when your blood pressure gets really high, you get a headache because, look, your head can't expand, right? It's bone, wood for some of us. And so when the blood vessels inside the head, when that pressure expands, it pushes the brain against the side of the bone, and there's nowhere for it to go. So you get a throbbing headache from your high blood pressure. But in other areas of the body where you've got a lot of little capillaries, so like in your retina, on the back of your eye, in your lungs, in your kidneys, those capillaries can start to burst from the pressure, because essentially the capillary pressure should be close to zero. And when the blood pressure goes sky high, that capillary pressure goes up and they can burst. That can cause some blurry vision. That could cause blood in the urine in an extreme, case, and coughing some blood and stuff, which is, obviously people know that's bad and that's not something we see real commonly. But the point is, you go from my blood pressure's high to my blood pressure's high and I've got a headache, to my blood pressure's high, I've got a headache, I'm short of breath, and my vision's blurry, to my blood pressure's high and I'm having a stroke. And coincidentally, I actually saw a patient today in my office who had had a stroke from high blood pressure in the past. So we need to recognize, these different scenarios in the dental patient, and we need to know how to handle them appropriately. If your dentist isn't sure what to do, they can get the primary care doctor involved. But you're going to also have to talk to your primary care doctor. And look, if your primary care doctor says, I'm managing you as best as I can, and your blood pressure just goes high when you get around a dentist, and your dentist still says, well, I don't care if it's not better, I'm not going to work on you, you're going to have to maybe find a new dentist. And yeah, the dentists are busy and the primary care doctors are busy, and getting them to talk to each other and sort that out is not always easy to do, and it's frustrating, and I get all that. And as a doctor, I know it's hard for me to stop in the middle of my day and call another doctor to talk about something like that. But sometimes it needs to be done. And then, as a profession, I think that we dentists need to just have a better understanding about blood pressure, and how do we think about blood pressure, and how do we decide in the acute moment, right now, right here, today, is it safe to treat this person or not? Versus, is this person at their long-term goal for blood pressure? Those are two different scenarios. We need to know more about that. So it's kind of a rambling video. I just wanted to throw out some thoughts. If there's questions or comments or whatever, put them down below. I'll be happy to answer them. You can also find us on Facebook and Twitter and Instagram and all that kind of stuff. Yeah, if we can help you at all, just give us a call. It's 210-778-0002. Thanks. Have a good night.